All right, and next we have a panel discussion, everyone, on the topic leveraging technology in procurement, AI automation, and the digital revolution. And to do so, I request our moderator, Dr. Arnab Banerjee, Director, Supply Chain, AI, Smart Manufacturing, and AI, Micron Technology. I request you, sir, to please come upon the stage, and everyone, please give him a very, very big round of applause. Dr. Arnab Banerjee is an accomplished leader known for transforming people, processes, data, and technology into strategic assets that drive business growth and competitive advantage. Currently at Micron Technology, Arnab leverages his strategic and innovative mindset to collaborate with global business partners in advancing supply chain operations through data insights, data science, and generative AI solutions. With 22 years of diverse experience across product development, technology, and business consulting, program management, and supply chain functions, Mr. Arnab is dedicated to enhancing business outcomes through optimized people, process, technology, and data solutions. Everyone, can we give him a big round of applause once again? I request you all to keep applauding while I call upon the stage our panelist, Dr. Hari Ambadapudi, Value Advisory, Finance and Spend SAP. Please applaud everyone. Please keep applauding for Mr. Pallab Banerjee, Head Supply Chain Management, Gleneagles Hospitals, India. And next, I request you all to keep applauding for Mr. Balakrishna Nadella, Head Strategic Sourcing, JODAS EXPOIM Private Limited.
Am I audible? Yeah. Let me repeat what I said. I am struggling with a sore throat, so I will try to do my best. My sincere apologies for my voice today. As you heard, we are joined by Balakrishna, Pallab, and Dr. Hari. The topic for today was leveraging technology in procurement. And with this panel, I would like to talk about first how we have thought of making this engaging. So we will explore 4 key themes of various technologies and AI that are transforming procurement and reshaping the world and the way we do business. So we will look at the descriptive and diagnostic analytics first, the very basics of analytics in a way. We will look at how industries are using it. We will look at the traditional AI part, the prescriptive and the predictive analytics. Then we will touch upon a little bit of generative AI and other emerging technologies. And lastly, we will also touch upon some industry-specific thing, because as we talk about AI and generative AI, there are certain industries where there is a lot of challenge in adopting these. So we will touch upon these, okay? So I will first start with Balakrishna. And my first question is around the descriptive and diagnostic analytics. Can you share some examples of, and maybe before I ask the question for the benefit of everyone, I know it's a huge crowd and people are coming from different domains. So when I talk about descriptive and diagnostic analytics, it is about getting the insights of the data. We all use ERPs, and there are many systems which generates data. It can be ERP systems, it can be WMS systems, it can be many other systems within an enterprise which generates data. Now, data is the new oil, as you all have heard. Now, when we are using these technologies, we generate the data, it becomes very imperative for us to use it for our advantage. And that is where we want to get more insights. And this question is about how our technology, how our companies using these insights. So my first question to you, Balakrishna, is can you share some examples in your organization how you are leveraging descriptive and diagnostic analytics, how these insights contribute to your business decision making? And can you highlight a specific case where you influenced a strategic or operational decision?
See, am I audible? Yeah. So thanks for the question. So generally depends on the industry where I saw here majorly many of the different industries, diverse industries, people are there from the supply chain. So it's generally the organization, like you said, the analytics, descriptive analytics depends on the product and the business, company runs, that the organization runs about the product or services. So initial, we need to evaluate which kind of products are, like you said, mentioned descriptive analytics. So in different organizations, few MNCs, they have different kind of departments, I can say. It's not procurement. Generally, few companies, procurement guy take care of this profile, and few companies they had portfolio management, a separate team will be there. That's they are the part of MNC companies. Indian companies, if you come, so few there are project management teams, or else few companies are having only procurement supply chain guys comes into the picture to evaluate that product, how the previous demand is there, or like in future how it is going to have demand, or also you had what you say alternate of those products which are coming challenging in future. So generally people had a few tools or like I can say subscriptions. Few of them are very expensive. In the previous companies we do have IMS kind of a subscription where the people evaluate which product is having more revenue generated for the organization, or else how it has been previous years the product, how it has been having the business, or else coming up new products alternative or superior to the existing product. So it depends how the volume and how the value added to your organization. All those things, business analytics, we evaluate last 4 or 5 years what is the business trend of those product, or upcoming what is the demand to that product. Kind of we have charts we prepare, and we have some pre-apex apex meeting kind of something, and we decide to take this product further, or like analytics, or in our industry we can say it's like analysis. We do analysis, all this kind of business analysis from purchase procurement perspective, and this we make one chart, so kind of something, and we present to the management before taking decision whether to add this product to the organization, whether we can do this business, or else some other product. So this is how we had few softwares or subscriptions. We do all evaluate the value, volumes, demand, all those things kind of few all together we evaluate, and we decide whether this descriptive analysis or analytics what you mentioned. So this comes, I mean to say, it's a direct procurement, we evaluate this, but in CapEx, OpEx kind of AMC, we can't do this descriptive analysis or analytics in the industry. Depends on the category, special, I mean to say.
Thank you, Balakrishna, and touching upon so many areas where you are using the descriptive analytics. I will move to Dr. Hari, and what Balakrishna is saying, like the way they are using these analytics. Can you touch upon what are the different, because in order to enable these, there are multitude of things which comes into picture. It talks about the people, the tool, the processes, the data, and everything. And as Hemant was presenting in the previous session, where he's talking about the item creation and vendor creation and all those things, these also comes into picture, because if you have to analyze these data. So can you touch upon what are the things, can you elaborate on the foundational elements necessary to ensure the success of such things?
Sure. The foundational elements more or less remain same, in the sense that the process, the people, technology, they more or less remain constant throughout. But the way we are trying to approach, or we are trying to exploit these foundational elements to suit to the transformational era is going to be different. Let me take a simple example. I'm trying to take an example of finalizing a supplier and their payment terms. Broadly, there are two parties, two teams involved in this. This supply management or buying team, procurement or sourcing team, and the finance team. They need to have a kind of cross-functional alignment in order to understand the organizational goals. So fundamental is, do I have a collaborative working environment which is supported by the process? And the process, many times these processes, as we all know, happens in silos. I may be finalizing a supplier, but I may not have analyzed the impact of the payment terms on my cash flows. So these things, though individually they are an optimal decision, collectively they don't actually solve the global maxima for me. So a cross-pollination of these two functions coupled by a business process. Many times, as I was mentioning, if the business processes are not correct, business processes are not defined to deliver a global optima, there is always a compelling need to do that. And from SAP side, SAP Signavio is the best tool which can define the business processes, identify the anomalies in the process that we do, and also earmark the kind of KPIs that we need to monitor, measure for a global optima. And coming back to the technology, if many people are getting involved in solving a common goal, we need to have a unified data model. And with SAP's robust data model and also the latest engagement with Databricks, it's going to deliver a seamlessly scalable solution which is going to help get those views, not only for the descriptive analytics, but also all kind of analytics that the organization may need in the days to come. So this is how all the foundational elements are going to come together, and they are going to deliver a cross-functional impact, aligning with the business goals.
Thank you, Dr. Hari. And as we touched upon these descriptive and diagnostic analytics, we talked about the basic fundamentals, what is needed to enable it. Let me move to the AI space. And this is a question for you, Balakrishna. And when I say AI, I will talk about the prescriptive and the predictive analytics. Prescriptive analytics is where you generally use some kind of a machine learning model where you will learn a pattern, and based on that pattern, you will predict something. Now, there are multitude of models available in this. So you will start predicting. Now, prescriptive is where generally it's less of statistical and more of mathematical models, where it is more definitive. Prescriptive is also where optimization generally comes into picture. Now, in order to enable this, first of all, you need to have the technology as well as the business, I would say, need for it. Now, with that, the question to you, Balakrishna, is in the procure to pay process, which is the life and bread for everyone here, and it is all the way from requisitioning till payables. Can you provide an example of how AI-driven predictions or prescriptives has been used? And what kind of tangible benefits in your organization, or you can generalize it as well for other organizations, have you seen? If you can provide it to the crowd.
Sure, definitely. It depends again the organization, which organization having more systematic, like many of them speakers earlier, they had SAP, Ariba, many kind of ERP, the tools what they are using. So we can simplify adding more systems to the organization instead of getting daily purchase requisitions. Everybody is manually sending any mails, kind of requirements and all. So everybody has to be aligned with that tool organization, all the cross-functional teams, departments, I can say. Generally, AI cannot be predictable, particular to what specifically I'm in the pharma industry, pharmaceutical. Few areas, like quality assurance, quality control, kind of something we cannot predict AI to implement their system, because once the material gets procure to pay, so auto-generated PRs. So auto-generated PRs, before I go to before step, I can say once the material gets GRN in the system, automatically by end of the day after 12 o'clock night, so the automated PRs will be generated in the system and it goes to automated PO. Automated PO, the gap is between PR to PO. We need to put the annual prices. Then only the maybe pricing part will come into the PR to PO, PO to supplier, and again supplier has to acknowledge in their system, because we do provide in some organizations the websites to the suppliers. Everybody goes in the system, their websites, and they acknowledge our orders. Then automated, when they acknowledge, automatically the supplier has to put the delivery lead time or dispatch timelines in the system. Then automatically it triggers to the planning, production planning PPIC kind of system. Then PPIC once have the information, everybody in the morning, every department will see their logins. Where is my material? Where is the orders has been placed or not? What is the stocks available till today? How many days I can run the production? Or else based on this all data from PR to delivery of the kind of material, we can make a systemized or AI kind of technology here. Once material enters in the plant, then GRN happens through warehouse or team. Then from there till we can take the AI technology. So from, if I say a material or like a raw material, I can say from the pharma background. So once it gets GRN made, so again the manual system has to go to the sampling has to be done, and it has to go to the QC, and they have to test. So if they have some rejections, then AI cannot support in this way. That's the reason only few PR to GRN make process, we can make the AI technology usage here.
Thank you. Thank you, Balakrishna ji. I would like to add a couple of points here, like what I have seen in my previous consulting role also. Like when you create a PO, today you are blind at the time of PO creation that whether this PO will be delayed or not, right? Whether you will have a quality problem with that PO or not, you are blind. So one of the things which we had done is based on the historical pattern, you will indicate a number, and it is between 0 and 1, which will indicate what is the probability of this PO getting delayed. So you can get a number like 0.59. Now 0.59 means 59% chance that you will get a delay on this PO. Or you may have a 0.75 number which will say that you may have a quality problem. Okay. Now this, and how you are getting it? Yeah, you are using some machine learning algorithm to learn the pattern and all those things. Obviously, if the supplier is so poor, you are not going to have a business with him, right? So this is how I would put AI is coming into picture. And not just in the requisition to PO process or requisition to pay process, but even like when you evaluate a supplier. It is one thing to evaluate a supplier on his on-time delivery or on the quality and all. You can have, and I think the SAP people were also showing it actually, you can have a lot of criteria built in. You can give a weightage, and then you can put it into the models where it will come up with the analysis to tell you like which supplier is doing very good, and you can do it, slice it by a particular category and things like that. So this is what is happening in the industry today, and not just in the supplier evaluation or even in the other things, even maverick spends. In a global organizations, you may have a lot of maverick spends, and you can use a lot of algorithms to identify, is it a behavior with a particular buyer? Is it something to do with a particular location and things like that, which is being used in the industry today?
Like vendor management, you can say.
Vendor management, yeah, absolutely. So moving ahead, I would like to ask these, I will ask a question to Pallab. So we are talking about AI and all these things. In a tightly regulated industry like the medical technology, hospitals and pharma, from which you actually come, you have an extensive experience in these. Can you give some insights as to where is AI and automation being adopted? What are the reasons for these adoptions?
Okay. When technology is evolving so much in the last few years. So definitely the healthcare, the hospital industries should not be fall behind. Now can you imagine just 5 years back, if we ask any patient that you should not visit to the doctor, you just sit in your home, doctor will advise you what kind of medicine you need. He or she will say, क्या बकवास कर रहा है? ऐसे possible थोड़ा ही ना है. But just think about what COVID has taught us. With COVID, as there was the restriction of going outside, healthcare have used the technology in their advantage. Now, it is in the cities actually, it is very common that people are sitting inside their home, open the system. Now, digital evaluation and the AI has such an impact that doctors can see, doctors can diagnose, doctors can give the medicine prescription online, and even the delivery also can be done online. Patient no need to go outside to the doctors. This is one thing. Second, many of you might have heard, but I'm just giving an example. With the advent of the robotic surgery, it has been published, actually it has happened in October 2024. The patient is sitting in Morocco. The French doctor, he is making the surgery in a Chinese robotic system from Shanghai. Distance is 12,000 kilometers. And the patient, he has actually the prostate cancer and doctor is operating. So this is the use of technology. And this is, I have told, this is the longest ever done the surgery done remotely. Now we can know that the robotic surgery, intuitive is very common, I mean people must have known. But apart from intuitive, many other players like Johnson & Johnson, Smith & Nephew, they would name a few. They are doing the orthosurgery, neurosurgery, gastro, and with this advent of the technology and the adoption, healthcare has accepted that. So these are the two main things. It is very uncommon maybe to you, but it has been predominantly has been used in the last few years, and it is going to happen much more. Third thing you can know, US FDA, in the healthcare sector, 70% of the US FDA approval comes on the imaging technology, like our scan, be it X-ray or the MRI in the CT. Now by seeing the scan in the X-ray, doctors can a little bit of idea, I mean, more or less an idea that, okay, here the lesion is there, here the crack is there. But with the advent of the AI and the use of that technology, doctors can now diagnose much better where is the using this predictive analysis that what is it is going to do, which by the blind eye, probably it is not possible. So these are the few things. Many other things are there obviously, but because of the time, I'm just giving the few important things where the healthcare is moving. 5 years back, we probably could not even imagine out of those.
Thank you. Thank you, Pallab. So can you also touch upon like what are the challenges for the adoption of these AI? Because I know, or we all know that it is not very widely adopted in pharma and in hospitals and all. What are the challenges? And you can share your thoughts, how it can be overcome.
Few things definitely will be there. See, healthcare, one of the report published by World Economic Forum somewhere around December 24 or in the January, we are seeing that journal. As an average healthcare sector, that is across the globe, considering Europe, EU, and US, as well as the Asia, LATAM, healthcare adoption of the AI in the healthcare sector is less than the global average. The score is somewhere around 300 or 299, wherever the average of all the sectors, it is coming at approximately 315, something like that score, maybe plus minus one, I am forgetting. So healthcare is really a laggard in the adoption of AI. Now forget about US, EU, let's speak about the India. If we ask about the management, what will be your spend in the technology? They will always say, like in the previous speaker has told, they see the supply chain, they see the CTO just as a cost center, not the profit center. So the budget allocation will be a major challenge. And even if the budget has been allocated, see, this talking about we are in the private healthcare sector, but in the India, largely it is approximately 70 to 75% of the healthcare providers are the government organization. budget allocation is one of the thing, and people see AI in a negative way. The perception I'm talking about, that AI will take out our job. Actually, it is not the case. It is just like internet that will also create more job, not taking the job. But that perception is there, AI will take out the job. And secondly, patients are also very sensitive about their data. If AI is being involved, so every patient's, every diagnosis will be available and visible to multiple people. We can say to the people by our pride that, okay, I'm going to marry, or I have my son or daughter has been born. But none of the people will be eager to give the expression that I have this disease. Nor their even relatives will have that passion that we will share this reason and share this to others. So these are the things. Apart from that, inertia is there. People doesn't want it to change because they have to adopt the system. And that skill set, healthcare, as I have told, it is still a laggard. The skill set deficiency is also there. So management is also sometimes not accepting the fact that by advancing this technology, adoption of the technology, we can go far. Many times we see that they just delegate the job. It is the part of the job of the CTO. CEO said that it is the part of the job of the CTO. CTO gives it to the CPO. CPO gives it to the next level person. Ultimately, that interconnected and the ownership, that is lacking. I'm just talking about the private sector now. We can imagine what is there in the public health sector.
Thank you, Pallab. Just to add, one of the things I was discussing with a startup co-founder last week. I met him in a conference, and he is into like extending credit lines for dental implants and hair transplant and all those things. So I said, why are you not getting into insurance? And he said, no. Wherever there is a chance of mortality, we don't get into it. So I think one of the key things which I would like to touch is where mortality comes into picture, things change completely, whether it is AI or whether it is anything else. And that's an important, very important human phenomena we cannot ignore. Coming to my last question, no discussion on AI would be complete without the mention or the questions on generative AI. So this question is for Dr. Hari, and I am slightly thinking that previously you were showing all these generative AI things, so I don't want you to touch upon these again. But how can organizations use generative AI in any way? Mainly to, as I see, it is mainly to improve productivity and any other things which they can do.
Yeah, I mean, it's a real myth that we all think that AI is going to improve productivity. It is actually not the case. And one of the latest reports from McKinsey says that AI is also going to improve the strategy iterations. There are two parts to strategy: arriving at the strategy, arriving at the options, and having the leadership courage to execute the strategy. There are two things. Now I'm taking away the part that we are trying to show the courage to execute the strategy into action. That's a human thing. But there's a lot of leeway that we need to take to arrive at the outcomes, arrive at the options. Now coming back to the procurement, I'm talking about setting up the category strategy. Now Hem has shown a lot of beautiful charts, shown the technology. If I have to put in the AI element once again into that, right? I need to evaluate a lot of reports. I need to understand what's happening around the globe with metals market, with exchanges, etc., etc. On a, let's say, manual, semi-annual, automated, semi-automated basis. But all of these things, lot of this heavy lifting can be done with the help of AI. And once the outlining of the strategy is done, it is the execution that can rest with the humans. And most of the execution can also be automated. And the critical intervention with respect to decision making can be done by the human. At the same time, we can seamlessly execute the outlining, executing, and monitoring of the strategy. That's one thing. The other most important thing is, if I am actually getting into doing the contracts for the first time for a very new kind of engagement, very new industry, that's when AI can actually give us as a first point, starting point. Also understanding the compliance of my contracts with respect to what I delivered or what I expected. these are 2 to 3, simple things that, fall into the procurement domain where AI or Gen AI can be a real game changer for us. And him has shown a lot of beautiful insights how Joule, the co-pilot, as we all understand, co-pilot is nothing but this is going to help the developer or help the user. User or the developer is the pilot, and say Joule is the co-pilot which is going to traverse along with the real pilot and help doing things. So, lots of use cases. We're happy to discuss at the both outside.
Thank you everyone. So it was a very good discussion. Thank you Balakrishna ji, Pallab and Hari. We had a very distinct panel where someone from the pharma, someone from the hospital and someone from the product background. I hope you all made something out of it. Thank you so much.
Thank you so much, everyone. If any of you have any questions, you all can ask during the networking break. We would like to felicitate you all. And to do the felicitation, I request Mr. Rutvik Dev, Head Purchase and Supply Chain, MYK Laticrate India Private Limited, to please come upon the stage and felicitate our moderator, Dr. Arnab Banerjee. Everyone, please give him a very big round of applause.